So we, as you, most of you know, went to a mission essential posture on Tuesday. And really where we are is a place that I've been describing to you for a couple weeks now, and it took a lot of work to get there, so that we can continue to execute those mission essential functions, to continue test programs, to continue training airmen, soldiers, sailors, to continue our readiness for real world and contingency ops. And we have all that in place, and we started executing on that battle rhythm on Tuesday. And then we have the executive order now with the Safe at Home. And what that does to us is enhances what most of you are already doing, but our mission essential activity continues. That executive order talks about essential activities, and that's why we identified what's mission essential out of our missions and who is mission essential, so that we can continue that during this Safe at Home executive order. So based on that, we are going to, as residents of the state of Florida, follow those, follow the executive order, but we also are going to continue essential activity that it allows, which is national defense. And as I've said before, national defense doesn't stop during this crisis.
One thing I'd like you to address a little bit is your relationship with the community as this past week or so has been going on. I know there's been a lot of interaction there and trying to stay in sync with our local elected officials.
Yeah, absolutely. I have to say that our support from the community, as it always is, but especially now, is incredible. And without that, we couldn't be doing what we are today. So thank you to our community. I think you asked me before, Andy, about that communication, how often it's happening. I think it's accelerated over the last week or two, and this is a fast pace that we're on as far as how changes are happening, how this is evolving, how we're trying to stay ahead of it. And so it's been incredible to me to see the support that we're getting from the community, and appreciate them reaching out to us with offers of support, in addition to me telling the community what it is we need to succeed. And that community is pretty wide, I will say also. It's the local community, it's anyone who's been at Eglin before are helping us. It is really a national, maybe global network that's Team Eglin. We talk a lot about the local community, but I've really seen how that has become a much wider web of support for this mission.
Awesome. I wanted to turn to the chief real quick. Chief, I know you've been very close with all the helping agency activities, but we have a new team that's been formed, the COVID-19 reception team. I think that just this week has been activated, if you will, and starting. Can you kind of give us a description of what that means for incoming people that are PCSing in and out?
Absolutely. So what we found out was, through the Area Education and Training Man, the technical training graduates and the pipeline students are still coming here because we're still producing airmen. So in order to get a handle on that piece, as well as with the restriction of movement order and the stop movement order for PCSs, we're having nobody leave. So we had to look at this from a multi-pronged approach. How do we maintain control of who's coming on the installation? Also, if we do overflow our dorms because of all of this movement we have going on, how do we get after this? So we had some great work, identified each room. We have that numbered down of who's coming here. We worked with our Navy EOD counterparts. They've allowed some, freed up some dorm space. But we also had to develop a plan. What happens if somebody has to go in the dorms in there, have to self-isolate, or if they're under quarantine, or if they have to be restriction of movement? Who takes care of that?
Right.
Who gives them the resources and the family care that we would typically have in a typical home environment? So our Force Support Squadron stepped up and said, we want to take this on. And so what they're going to do now is they identify, hey, who is tested positive for COVID-19? We then move them to a separate dorm, per se. It's going to be our Riptide. They get them over there, and then there's a whole flow of things that they do as far as They make sure they bring their laundry. They make sure they have all the resources that they need. They make sure they get fed, cared for. Any of the resources that they need, this team is gonna lodge them, bed them down, and take care of them. That is a huge win that we have, and this was through our Force Support Squadron, through the MSG, and they said, this is something that we feel is important, we wanna take this on. As well as making sure that we have any new inbound personnel who may be coming from a tier 3 or a tier 2 location that's high risk,
Right.
and they have to self-quarantine. We want to identify those individuals and put them in contact. So I appreciate Colonel Carter and Colonel Boeing and their team really stepping up and offering that service, and we just started this week, so.
Do you have a sense of the kind of numbers we'll be talking about in terms of people? As we start going, we're looking at the PCS season, wouldn't normally be happening.
Right. So we are in constant contact with our A1 community. That's our personnel. So they get an inbound roster. So just to give you a rough wag, what we're looking at right now. So it's about 40 personnel we're getting in the next month that we'll be getting. And when you don't have people leaving and you have to keep getting people in, that's what we need to be continuing on through that. So that's just on the airman front. And there's other people who are married, who are coming in as well. So we're working that piece.
Before I transition to the mid-group, boss, I want to ask you one other question. Can you take a look down the road the next 2 to 4 weeks and give us a sense of where we think we might be headed? Or is it that unpredictable at this point?
I think, so this is a great question for our medical group and for our medical experts to give you a very high fidelity answer on it. But I think what we're seeing, Andy, is the picture becoming clearer of where this is going to peak, what that timeline is, and that'd be a great one for our medical folks to come in and talk to. But we are seeing the answer becoming clearer based on being closer to the answer, one, but based on a better understanding of the factors involved. I can say that when the model considers the safer at home, and if our communities do comply with that executive order as it's intended, it significantly affects that curve and has that flattening effect to make it more sustainable to have the right number of hospital beds. I'll hand it over to Matt to talk about some of those specifics, but over the next 3 to 4 weeks is what I'm seeing as this approaching peak, and all of our posturing and preparation is right now tailored to that. Continue to assess local conditions because there is certainly uncertainty still in the predictions, but it's becoming a clearer picture of what we're gonna see. Matt?
Yes, sir. As a medical community, both military and civilian, when we look at the cases in Florida, they continue to rise, and we expect them to rise over the next 3 to 4 weeks before we're at a true peak. Right now, we're in, as the General said, we are in a position where we are doing everything we can to flatten that curve. At the hospital, some of the efforts include diagnostic testing for people with symptoms who have had close contact with someone with COVID-19, or maybe have traveled to an area where there's increased risk, identifying those individuals, isolating and caring for them, as well as quarantining their close contacts through an effort called contact tracing that we do in concert with Okaloosa County. We've also deferred care that can be deferred and taken actions to care for our population, oftentimes through virtual health, through telehealth or telephone, but limiting the movement of our patients and limiting the number of people coming into our facility. Now, those efforts that further flatten the curve are important, but there's probably nothing as important for our population than following the governor's direction for safer at home. I would argue that as military, civilians, active duty, as veterans and retirees, as family members, we need to be the role models for our community. We make up a significant portion of our community, and if we execute this order correctly, if we recognize that we are truly safer at home in this month, we will see the number of people required, that require hospitalization and intensive care drop dramatically. So when I work with my civilian hospital counterparts and we look at the models together, we find that the peak that we're preparing for will more than likely be the last week of April, first week of May. But if we execute this order together, we'll find that peak will be lower and it will not overwhelm our hospitals the way it's overwhelmed hospitals in other states and other countries.
Colonel Matt Hansen, Matt Hansen, Med Group Commander, a very familiar face, is becoming well known across the community. Can you talk a little bit more about the readiness and the current capability of the hospital itself,
Yes.
satellite pharmacy, and perhaps some of the other facilities and how we're working that?
So like the rest of the Department of Defense and much of the American healthcare system, we have converted more than 80% of the care we deliver to virtual health. So you are talking to your physician, you are talking to your nurse, you're talking to your specialist, in some cases even your surgeon. Mental health is also providing telehealth services. So those capabilities still exist. We are deferring elective care that can be deferred and some routine care. We realize there is some life-saving care that still has to go on. So we're still providing that, but doing everything we can to protect our patients and our staff. Our emergency room still continues to be open, but we'd really like you to call us first. And we can take care of your acute and emergent needs over the course of the days. But please call us first, talk to that healthcare provider, and they'll tell you where we'll meet you and how we'll provide that care. It may not be the same way as you received care last time. For instance, we have a drive-through urgent care now, so that you don't have to get out of your car and go into the hospital. We can take care of you right in front of the facility and safely, if necessary, even test you for COVID-19. But call us first.
Matt, can you make it clear to everybody what our base posture means between mission essential and the official business part of the restriction of movement order that I made, and what that means to your patients and who's impaneled at the hospital?
So from the Department of Defense, the state of Florida, or even a national level, healthcare is critical infrastructure. So the hospital remains open. We are still taking care of patients, we're still taking care of active duty and their family members, we're still taking care of our enrolled population. Our drive-through pharmacy remains open, and we will keep it open as long as we can. If we have to change the hours or the days that it's open, we'll send that out to the population as soon as we know that we have to make a change.
I want to be clear about that. The letter that you've sent out, boss, and also in the recent ICD, talks about official business, including access to the satellite pharmacy, not necessarily a traditional interpretation of what I would say was official business.
That's right. That was exactly what I wanted to make
Yes,
sure was clear to everybody, so I appreciate that, Andy. And Chief O'Shea described it in a great way, the pharmacy in particular, and some of the changes that have happened over there with the lines and what used to be lines of people waiting for the pharmacy to open or for just getting their scripts. You've restructured that so those lines of people have turned into lines of cars.
Yes, sir.
Can you explain how that has happened?
So we do not want people, especially ill people, to congregate in our lobby. So at this point, if you even have an off-base script that you want filled, we have a way that we can take care of that without you getting out of your car. So you should expect to be in your car when we pick up your script for you and give you a time to come back. Or if you have a prescription ready and you're coming back to receive it, you should expect a little bit of a wait, but you won't be getting out of your car. You'll be picking up that prescription through the drive-thru.
Okay, and you've had to literally re-wicker how that traffic flows in the parking lot there. I know that's been a challenge, but that's just another,
Yes, sir.
I said right at the beginning about all of the ideas of working together, right? Those are folks in our own medical group working with our security forces and others to come up with a plan. As simple as it may seem, that's someone's idea on Team Eglin that is making that possible for all of our beneficiaries. And I just wanted to point that out. It's just one what seems like a small story, but a huge win for taking care of our population.
And you're also encouraging the mail order system that's available, I think, as well.
Absolutely. Again, we are safer at home. So the mail order option brings your medications right to your house. So
I'm a big fan myself.
Clearly the best option.
Anything else, sir? If not, then I'll move over to MSG and bring in Colonel Carter.
So I was just gonna add that we are preparing for the peak. I know that there's been discussion in the community about not enough PPE, personal protective equipment for healthcare providers, not enough ventilators. We're looking at all those, staying in touch with hospitals that are seeing more patients than we are, and making sure that we're prepared.
I will just highlight, while Colonel Hanson is still in here, if you take one thing away from this, it's probably that incredible leadership message that you just gave, Matt, about being the example for the community and the effect that this has on how we fight the virus. Is incredibly well said, but that is probably the most important point that will come out of today. I don't want you to stop listening, but that was a great message for Team Eglin, so thanks, Matt.
You bet, sir.
Thank you for joining us.
You bet, Andy.
Colonel Carter, I believe you're on deck, if I can ask you to come in for a few minutes.
Yes, sir.
For those who haven't seen Colonel Carter before in our format here, the commander of the mission support group, welcome.
Thank
Just a
you.
couple of key points that you might want to point out in terms of base access and where we are with other functions within MSG.
Yeah, so base access is very important to us. The boss had put out a memo essentially saying that we will only allow visitors to come on base, which is very important. So we clamp down a lot as it relates to who actually come on base. So with visitors only, not visitors only, but visitors being taken off their road to come on base, that has really made a difference in this mission essential situation that we currently have. Now, that doesn't mean that visitors can't come on base. It's got to be approved by union commanders and all that kind of stuff to make sure that the right folks come on base at the right time. The Child Development Center, I know you asked about the Child Development Center. We still have the Child Development Center open, but it's for the mission essential folks to use the Child Development Center. So we're still providing great care, but it's a limited version of that great care we actually provide.
And I know you've been the liaison with the commissary and those folks. How is the commissary function performing right now with the limited hours and some of that? It's been a bit of a challenge. We've heard some of the community.
Yeah,
complaining about
and
some-
Andy, I think maybe I can, Colonel Carter can give us some details on this, but it's a good one for me to address as well. I described this a little bit before, but literally what I saw was the shelves going empty and us not able to sustain the operation, and that's for all of our population that uses it. I'm very focused on continuing the mission and supporting our active duty that are executing that mission, and that was a very primary consideration in that change that we made. And I know that doesn't give as many hours to the whole population, and that's difficult for me and for you. But literally, I have seen the ability of our active duty and dependents to get what they need to continue supporting their families so that they can execute the mission change since we made the adjustments in the hours in a way that I can have a medic that's working long shifts, 12 hours maybe scheduled and probably more at the hospital, still able to go get what they need in the few minutes that they maybe have or that their spouse has to get what they need to keep going and keep executing mission. So I understand that it's difficult to change those, but that's where my focus has been, and it was something that Colonel Carter helped me along with the commissary and DECA, who worked very well with us, make those adjustments, and it's put us in a lot better place to execute our mission.
I just add one thing. It was a tough decision, but it was the right thing to do. Right? It wasn't something that we wanted to do. It was something that we had to do. So
And it's not
Thanks,
forever.
Henry.
It's not forever. It's,
right. That's true.
Thank you for joining us.
Thank you.
Yes,
Appreciate
sir.
it.
Thank
Okay.
you.
Thanks, Doug.
All right, thanks, sir.
Boss, I think we're gonna wrap this one up.
Okay.
I don't know if the chief wanted to come back in, but if you had any closing thoughts?
Yeah, I'd love to get Chief back in here, and while he's coming back in, I'll make one of my two closing thoughts. But the first one is we talk about those successes that we're having and the creativity and how we've changed how we do business here. But one of those things that gives me hope and motivation and keeps me confident that you're going to keep providing for the national defense is the sound of freedom that you still hear over Eglin Air Force Base and in the community as we fly airplanes. Our flying squadrons, our maintenance squadrons, our logistics squadrons, everybody who supports that and many operations here have been way ahead and come up with plans, pacing the fight here and keeping missions going. And just to be able to hear that sound still is a big motivator to me. And it took great forward-thinking leadership that happened down at the squadron level to make that happen. So thank you to all my leaders that made that sound still hit my ears most days still. Chief, I have one last thing to say, but I certainly want to give you a chance to address the audience one more time.
Sure. As I was thinking of things to thank our team Eglin about, I was thinking of two quick snippets, and the first one's going to be how our pharmacy transformed in what they're doing to versus actually walking in and doing that care they've done to now a drive-through service. And those airmen that are out there that created that plan, that traffic flow plan, so we can avoid that, and they have the drop-off and the pickup services. And they also offer our service to our enlisted village where they identify what they need and they take it directly to the enlisted village. So that's a huge win right there. And the second one, sir, from our logistical readiness squadron, our vehicle trans section, they know that if we have a large section of airmen in the dorms and they have to transport them after they tested positive for the COVID-19, they have transformed some of their vehicles with doors and things, and then come through the back end of their vehicles, so the driver doesn't have to get potentially impacted or infected. So they've done all that, and that's just ingenuity right there, and some hard work and some elbow grease. So kudos to both those teams. So I appreciate that.
Ready for me to close
Yes, sir.
up, Andy?
Final comments?
I said at the very beginning, I talked about all the airmen, floor sailors, Marines, Coast Guardsmen. I mentioned families in there too, and I want the families to know that I'm thinking about you a lot. Imagine, and we all have a sense for this, but the challenge of being any family in our nation right now with changes in schools, changes in that we talked about child care and our own CDC. There are a lot of stresses on our families. Our military families are already, before this, make incredible sacrifices. And just imagine what it's like if you're a military family right now, especially those with a deployed mom or dad, or even those that are not on our traditional deployments, if they're deployed in our own country, what it takes to keep the family going in times like this. And I'm thinking about you. We are doing things to make sure that the community and the team here at Eglin is supporting you. And I thank you all for the sacrifices that you're making so that we can do those things that I keep talking about. You're really providing for our national defense, so thank you. Andy, that's all I have for today. Team Eglin, stay safe. Remember, stay connected.